Hi everyone, we're going to kick off now. It's a few minutes past and people will probably join throughout the session. So thanks to everyone who's joined us. Oh, got a person joining. We've just noticed that a few people are at the chat. We won't be able to see the chat until later. So if you have a question, just hang off until we actually call for questions, because then we'll before I kick off, I just wanted to do an acknowledgement of country, pay our respects to the traditional owners of this land, the Ngunnawal, which is where we are, and the Ngambri, and to all of the traditional owners on the land you're meeting on, and also to all the Aboriginal and Torres Strait Islander people here today and our staff. So thank you for joining us. We're going to have up to 100 people. So this is our first webinar, so please bear with us if things don't go quite to plan or we don't get to all your questions. We do only have about an hour, so we're going to have a chat about the terminology guide, and then we're going to open it up to questions. So we thought we'd just start with a little bit of a background around how the terminology guide actually started. So the terminology guide started, oh actually, before I do that, apologies, I should introduce myself and the blonde. I'm Summer May Finlay. I'm a Yorta Yorta woman, and I am one of the Aboriginal and Torres Strait Islander co-conveners of Abon.
I'm Yvonne. Hope you all join this meeting. And I'm from Indigenous and grew up on Barrett.
Yvonne's also one of our board, PHAA board members. And here in the room, who you cannot see, is David Templeman, our president. So he is hiding from the camera at the moment, but he might come and say hello later. So now I've done the introduction. I'm not going to introduce all you guys or ask you where you're from, just because of time. So I appreciate that you're here with us. So with the terminology guide, we started it because essentially what we've noticed was with the PHAA that there is the national office, the branches and the six, and different people were using different terminology, and that's fine. But what we wanted to actually do was have a consistent use of terminology for the PHAA. I feel it's really important to make sure that people are consistently using the same terminology. And we also wanted in part for it to just kind of be a little bit of upskilling for our members as well around maybe what's appropriate and what's not. And one of the things we're really clear on with this guide is this is not a cultural awareness guide. This session is not a cultural awareness guide. This is really just about how to be the least offensive as possible. Essentially, that's what we're aiming to do. And also different people have different perspectives on this. So we are not saying that this is the Aboriginal and Torres Strait Islands perspective, but this is what the PHAA has decided.
The only thing I'd really add to that, I guess, summary, is that it's really important that we are using this across all staff in the PHAA, and that's something that you might want to think about also if you want to adopt this technology guide also. Think about not only the researchers and the policy staff who are writing submissions, you need to also make every level of staff that are aware of the correct most terminology. Otherwise, you end up with things like name tags being completely inappropriate accidentally, not with ill intent, just because it hasn't been shared.
And I guess, that's one of the things that as an individual and as an Aboriginal woman, I'm really passionate about correct terminology, because for me, if you can't get the terminology right and you actually can't name us in a way that we feel is respectful, then I sit here and I wonder, how can I trust you to get the big stuff right? And as a PHAA member and someone who's actively engaged with the SIG, I feel it's really important for us to make sure that we're leading by example within this space as the Public Health Association. And really, being respectful in both the small and the big things. So some people, I've heard comments where people say, language is symbolic. Why do you focus on capitalising Indigenous? I'm like, well, if you can't capitalise Indigenous, then how will you be able to get anything right? And I'm assuming that some of you can't hear us. So Rodrigo's just bringing us the microphone. Thank you. I'm just going to check the messaging and see how much people actually Oh, hard. Okay. Thank you for the heads up about the microphone. Okay, perfect. Maybe I just have a louder voice than Yvonne. It's possible. You want to add anything else? You counted them. Yeah, yes. I don't know what we said. So we're just, the people who have joined us, and because it was we didn't have the microphone close enough, we'll just recap slightly. So apologies if we're saying the same thing again, but David Templeman took notes, so we know exactly what we said. We were talking about how it's important for the PHAA to have use the correct terminology for consistency and also to be respectful.
About upskilling members about what is appropriate and how to do that best, and as Summer says, to be the least offensive as possible. So you won't always have the same terminology will suit everybody, but to be as least offensive as possible. And I think what I was mentioning that some of you could have heard before is don't just target certain groups of staff when you're sharing a terminology guide like this. It should go to all staff. Everybody has some input in maybe using terminology incorrectly or could be using it more respectfully. So share it with everybody.
And just to recap, we did this terminology guide was designed for the Public Health Association, so other people might have different interpretations for what's appropriate, and that's fine. So we are actually talking about it here as what we're doing for the PHAA and why. So this is no disrespect to any other organisation that may have a different view on or use different terminology. And I'm glad to hear that you can hear us better now. Thank you for the heads up.
Great.
So we might just kick off. So what we're going to do is go through some of the key points from the terminology guide. I don't know how many of you had a sticky beak at it before or when you got the link. So some of this you might already be across. How do I?
So one of the things that terminology guide really stresses is the need for positive framing of any terminology that you're using, and anything that you're writing about Aboriginal and Torres Strait Islander peoples shouldn't be deficit focused. And this is extremely important from a public health viewpoint. So if I give a really quick example, something like even the terminology that the government used in naming a program, in naming that the intervention, which is it implies a lack of empowerment, a lack of partnership. It implies something that's being done to somebody else. So you can see how important language is just in that one tiny little example. To use a more broad example, I'm going to use a couple of things that I'll share with you. I'll put them up on the screen if you don't mind putting the first one up. Both of these are written on online media in the last couple of months, and they're both written by people who care very strongly, who work in the Aboriginal and Torres Strait Islander health space, and both care very, very strongly about what they're writing about. But if you just look at the difference in tone here, in the first one, I'll read it out because I know not everybody has their screens on, they're saving bandwidth there. Despite an increasing population of people who identify as Aboriginal and or Torres Strait Islanders, nationally 1 in 8 have been to prison. However, nearly all of those jailed live below the poverty line. 40% of Aboriginal and Torres Strait Islanders live below the poverty line. 1 in 4 of those living below the poverty line have been to prison. Poverty, and much of it is extreme poverty, particularly in the remote and regions, is the cesspool of deprivations that underlie the abominable jailing rates. Where does the fault lay with 40% of people living in poverty in 2018? Nearly 100% of suicides of Aboriginal and or Torres Strait Islanders are of people living below the poverty line. The suicides of Aboriginal people living above the poverty line are few and are less than the suicides of non-Aboriginal Australians living above the poverty line. So I think that's a fairly strong example of a deficit-based approach to language. And it's very much, it's setting out all the problems. If you were just reading that, there's no way you would see that there was any solution. and I'm feeling quite depressed even having read it. It just feels it brings you down. Is the way to describe it. It's just a really deficit-based approach to discussing an issue. To talk about the same issue of incarceration, this is looking at from a different viewpoint. Another article, ACT Corrective Services recognises that increasing Aboriginal-led services within the Alexander McConaughey Centre, AMC, a minimum to maximum security presence is essential to maintaining cultural connection for Aboriginal detainees and improving overall wellbeing and safety. I'll just skip ahead. It is groundbreaking to have an Aboriginal community-controlled and managed organisation delivering health and wellbeing services within its own model of care to inmates in prison in this capacity, Thomas said. Winanga delivering health and wellbeing services in the AMC and changing the way the system operates is the legacy of Stephen Freeman, a young Aboriginal man who tragically died whilst in custody in the AMC in 2016. It is also groundbreaking for our sector, so it needs to be given the recognition it deserves. Winanga has commenced enhanced support at the AMC focused on female detainees and will move to full delivery of standalone health, social and emotional wellbeing services in the AMC in 2018. So in that case, you're seeing a similar story about problem, but you're seeing a very much partnership approach, you're seeing very much strengths-based approach, it's very positive language, it's talking about the things that are being currently done to move ahead, and it's also looking at strengths within local community, in this case the local art show, Winanga, and what they can bring to help solve the problem. It admits the problem. It talks about a terrible death in custody. It's not denying that there's a problem. It's not sugarcoating. It's just looking for a more positive way of framing it. And from a public health viewpoint, there's a few articles around that you might want to have a look at. One very interesting one on public health nutrition by Foley and Schubert. It's a couple of years old now, but looking at how to use a strengths-based approach, not only in the language used around nutrition, but also in an actual research approach and the way that you engage in your research and programs.
Yeah, and from my point of view as well, when I think about deficit, it doesn't often reflect what happens in communities. So when we focus on just the negatives, it kind of denies the positive stuff that's happening and the solutions. And there is always some really good stuff happening in communities that sits alongside some of that really negative stuff. But what it also does for me, and when I think about it, is I think we always talk about Aboriginal leadership needing to be at the forefront of any conversations around solutions for Aboriginal and Torres Strait Islander health issues or other issues, for that matter of fact. But if people are constantly hearing the negative dialogue around Aboriginal and Torres Strait Islander people, how will they ever trust our leadership to be able to get anything right? Because they will assume everybody, every Aboriginal person is deficit, essentially.
Yeah.
So while we need to talk about the negative stuff and the stuff that's not working well, we also need to be mindful of what is working well and also acknowledging that communities have a lot of strength. We wouldn't have been around for this long if we didn't, and we need to use those strengths. And that's the other thing. If we focus just on the negatives, we're not focusing at all on the strengths within our communities and using those to actually improve the other things that are happening. So to me, that they're really important.
And I think it's true, a lot of non-Indigenous Australians have internalised that deficit-based colonial language. And so it's important to focus on moving away from that. And sometimes it's difficult. I've recently been working in the field of suicide, and it's difficult to move away from, but it's something you have to really think about and work on and achieve.
Yeah. Sorry, I forgot to mention as well, if you're able to actually just mute your microphone, that would be appreciated. Just with so many people on there, we are likely to get a bit of background noise. Thank you for putting that up. Do we want to take
happy to, or do you want to take comments and questions at the end? Yeah.
So what we thought we'd do now is go through some of the terms which we use and talk about in which context we use them. So you can, for those that can't see the screen, we've got the terms Aboriginal and Torres Strait Islander, Aboriginal, Indigenous with a capital I, First Peoples, and then the language group or peoples. So the PHAA made a decision to use Aboriginal and Torres Strait Islander as its preferred term. And that's obviously all with capitals. And having said that, though, if we are talking specifically about Aboriginal people, i.e. people from mainland Australia or traditional owners and also Tasmania, then we would use the word Aboriginal. And if we do use Indigenous, and which we'll predominantly use that in an international context, because obviously there's Aboriginal people in Canada and Indigenous is a term that is well understood around the world, we always capitalise it. And recently we've started using First Peoples, which is less frequent. We'll use that, but again, that is a term that is an internationally recognised term. So, but the other thing is, and something which I'm sure a lot of you would do anyway, is that when you are working with the local community, that you do actually use they're the local language group or peoples. So, you know, I'm a Yorta Yorta woman, grew up in a Wabakal country. If I was to work specifically in on country, I would talk about, you know, Yorta Yorta as opposed to using the word Aboriginal. But one of the things we also stress is that when you're working with specific groups of people, these are the terms we use as the Public Health Association. We're a national organisation, and while we have state branches and SIGs, we did have to have some consistency. It's also really important to make sure when you're working with individual groups of people and organisations that you actually ask them what they prefer. Their preference is actually the most important. One of the things that I talk about a lot is, you know, a lot of non-Aboriginal people, non-Indigenous people have preferred terms. I mean, ultimately, it is how we want to be referred to, not how you actually want to refer to us. I appreciate that Aboriginal and Torres Strait Islander might chew up your word count because it does have, you know, a number of words in it. And if that is the case, use Indigenous with a capital I.
A way around that is also to start with Aboriginal and Torres Strait Islander people hearing Indigenous if necessary. That's one way around it, just so you're very clear at the outset. And I completely back up Summer in saying ask people, and that's also important when you're quoting. Don't just automatically assume that you should say, you know, Dr. So-and-so, and Aboriginal, ask if they would prefer to be named as whatever group they would like, or how. Just ask people what their preference is.
Yeah. And one of the things I know that comes up a lot is people say, oh, we're using Aboriginal to refer to both Aboriginal and Torres Strait Islander. And, you know, I'm not a Torres Strait Islander woman, but I have worked with people and that's actually not appropriate. They find that quite offensive. They are distinct people with separate language groups and separate cultures. So to use Aboriginal to refer to Aboriginal and Torres Strait Islander is not considered to be appropriate. So I just wanted to point that out. And, you know, in those cases, if you are concerned about using Aboriginal and Torres Strait Islander the full term, similarly, yes, use Indigenous and refer. But the other thing I was going to say is I know that some people use Indigenous when they're specifically talking about Aboriginal people. So when you're using Indigenous, it can mean Aboriginal and Torres Strait Islander people. So I do tend to use Aboriginal when I'm referring to Aboriginal people, so that there's that clear distinction that, you know, we're not ignoring Torres Strait Islanders, but we're also not including them, and this data really only refers to Aboriginal people. I think that is important as well.
Not to that, I completely agree with you in what you were saying there. And sometimes you might be doing research or running a program that is for a specific group of people that is only, as Summer said, applying to Aboriginal people. And so it can help just to be clear about that at the beginning so that there's not confusion later, just be really clear about who you're working with.
So one of the things that I like, I mean, one of the things that I mentioned, and it's in this document as well, is what's the difference between an AMS and an ACCHO, so Aboriginal Medical Service and Aboriginal Community Controlled Health Service. So they're both Aboriginal and Torres Strait Islander primary healthcare services, but there is a bit of a distinction which is made by NACCHO, the National Aboriginal Community Controlled Health Organisation, and it relates to the governance structure of the Aboriginal and Torres Strait Islander Primary Healthcare Service. So we decided to include in our terminology guide the difference for the Aboriginal Medical Service and ACCHO, Aboriginal Community Controlled Health Service, so that we actually know who we're referring to and under what circumstances. So to be considered an Aboriginal Community Controlled Health Service by the National Aboriginal Community Controlled Health Organisation, it's to have an Aboriginal and Torres Strait Islander board. So it's got to be community controlled. It can't be one of the government run ones. So for example, one of the government one runs in the Northern Territory. It can't be a mainstream led Aboriginal and Torres Strait Islander primary healthcare service. And some of the strict definitions around this is having 100% Aboriginal and Torres Strait Islander board. Whereas an Aboriginal medical service is any Aboriginal and Torres Strait Islander primary healthcare service, irrespective of what their model of governance is.
And I think that's really appropriate, important, I was going to say. We did some research last year in Western Australia looking at services and the number of Aboriginal staff and the number of Aboriginal board members in Western Australia. And the ACCHOs all, of course, had very high levels of participation. Other services, even though a large percentage of their clients were local Aboriginal people, didn't have any Aboriginal staff and no Aboriginal representation on their boards. And the problem there, of course, is cultural appropriateness of services and whether people feel comfortable going into the services if they're not seeing somebody that reflects their own self. So it feeds down to different levels. It's not just about this is a distinction between these two words. It feeds down to practice.
Yeah, and that's really important. You know, Aboriginal community controlled health services actually started by the community, run by the community for the community, and so their membership comes from. So they're a member-based services. Their membership comes from the community, so Aboriginal and Torres Strait Islander people. So they do deliver services that meet the needs of their community, and I think it's really important, as Yvonne said, to recognise the distinction between the two. And it's not to say that there's not fabulous Aboriginal medical services out there that have other governance models. There are, but the distinction does need to be made. If you are talking specifically about the ACCHOs, then call them ACCHOs. But if you're actually including other Aboriginal and Torres Strait Islander primary healthcare services with different governance models, then it's important to use the term Aboriginal medical service, not ACCHO, because there is that distinction. So we also decided to include some of the inappropriate terms. Some of them are not particularly well used anymore, such as full blood and part Aboriginal and stuff like that. That tends not to be used as frequently, particularly in formal documents. But we thought we'd include them as well because we weren't sure what people did and didn't know. And so we figured if we were telling people what to use, it was probably a good idea to tell people what was better to avoid. So for those that can't see the screen, we've got a number of terms here, and these are all, of course, in the terminology guide. So it starts with Aborigine, and then the acronym ATSI is another one we ask you not to use. Native, mixed blood, half caste, quarter caste, or 25%, 50% Aboriginal, full blood, and part Aboriginal. So they're the terms that, as the PHAA, we won't be using. And these are the terms as an individual, I would encourage people not to use. And again, it's about being the least offensive as possible. There are some people who may, Aboriginal and Torres Strait Islander people who may use some of these terms, but these are the terms which are largely considered to be offensive.
There are also terms that are imposed upon Aboriginal and Torres Strait Islander people by others. They're not terms that they've chosen for themselves. There's been some interesting Twitter conversation lately with regard to that, stating that, you know, Aborigine is the correct academic terminology, which simply that has been refuted strongly, but also it's just important to be respectful.
And look, speaking of the term Aborigine, I mean, I've looked at the history of the word Aborigine. You know, you've got the Aborigine Protection Board. So you're actually the term has been used in really negative context as well. One of the terms that's not on there actually, which has been omitted for some reason, I must forgotten it, sorry, is obviously the shortening of Aboriginal to Abo, which I even struggle to say. It makes my skin crawl. But yeah, the term Aborigine has largely had negative connotations, and that is why I think it's particularly a term to avoid. And yet we'll speak slightly closer to the microphone. Thank you for the heads up. And Rosalie, thanks for sharing that article.
Thanks
to everybody. This chat thing's great. Is there anything you want to add about?
No, I think.
Yeah. So we might actually open up to some questions. We haven't asked them to date yet, and I don't think there's been any questions, has there, on the chat? No, I'm going to assume there's been no questions on the chat. So if you have put one, you might just want to restate it. So has anyone got any questions for myself or Yvonne or for both of us?
There should be a mechanism you can hit that says you raising your hand. That we're hoping it's going to come up on our screen.
Yeah. We've got a shy bunch. Rosalie, do you have any thoughts? So Rosalie's involved, and I'm picking on you because I know you. Do you have any thoughts or comments on the guide?
Oh, look, I guess one thing that I find makes me uncomfortable is when I feel that Aboriginal people themselves are using wrong terminology. Like the Nacho Guide itself says, oh, we're using Aboriginal to include Torres Strait Islanders, and the term ATSI health check, that makes my blood boil too. Yeah. So I feel, how can I, as a non-Aboriginal person, be overstepping Aboriginal people in their own terminology?
It's a good question. And with the Nacho thing, there's a bit of a context to that one specifically, because Nacho was started as the National Aboriginal Torres Strait Islander. It doesn't include, say, the Torres Strait Island, the service that's up there, the Torres Strait Regional Authority, because it's not a community controlled. So I think part of that is recognising that the territory it covers, the traditional owners of that territory are Aboriginal as opposed to Torres Strait Islander. So yeah, that is a slightly challenging one, Rosalie, but there is a slight historical context to that. And yeah, but in relation to, I mean, I can appreciate your concern and not wanting to overstep by, you know, maybe being critical of Aboriginal and Torres Strait Islander people and their use of terminology. As an Aboriginal woman, I do privately sometimes tackle some of these issues because people don't often understand maybe where that language has come from and also how it's perceived by a large number of other people. But this is more about in relation to the document that, say, you write with the PHAA. So we don't need to criticise. We can just lead by example, and people as individuals have the right to choose the language that they would like to use. So someone's asked why ATSI is offensive. I mean, this comes back to a number of things where, and look, I know it's commonly used, and it was particularly used in the academic context where, you know, the word count was, you know, in a peer-reviewed article when you've only got 3,000 words. I appreciate that you're trying to cram as many words in as possible into this article. Look, ATSI just boils us down to a bunch of letters. And I mean, acronyms are not traditionally used for people. We use them for organisations like the Public Health Association, saying the PHAA. And it's also something that, again, has been imposed on us. And yes, some people of that Aboriginal and Torres Strait Islander people have adopted it, and that really is their choice to do that. And I always stress that individual peoples have the right to choose how they would like to be referred to. But the majority of Aboriginal people, if you ask them how they wanted to be referred to, pretty much no one's going to get excited about ATSI. Just putting it out there. So if it's not a term that we use for ourselves or prefer to use for ourselves, then we ask you not to use it for us. Does that answer the question? Does anyone want to ask another question about this or seek clarification?
Can I say something?
Sure, Auntie, yep.
Jeannie.
Jeannie, yep.
The word at sea, a Torres Strait Islander and I, of Aboriginal descent, we approach the government and say, to put it as at sea, you're talking about two groups of people. There should be an and between A and T. If you want to talk about us like that, put an and in.
Very nice. I mean, it is an important distinction to make that there is two distinct groups of people. Aboriginal has obviously as well large number of groups of people underneath it, but there is more similarities than there is. But we still encourage the use of Indigenous if you're thinking about your word count rather than ATSI, because a large number of people do find it offensive to use ATSI. Even if there is an and in there, the preference would still be to avoid the use of the term. But that's a really good point to make, that the and actually is a significant component.
And especially when you have two groups of people living in a small community. Half is Aboriginal and half is Torres Strait Islander.
Absolutely.
And it's a lot in Queensland.
Yeah, and Queensland is predominantly where Aboriginal and Torres Strait Islander in its full term is used, because there are a large number of Torres Strait Islander people up there.
Absolutely.
Yeah. And someone, I think, Rosalie, you've just put up the comment there. I assume that's from the video I've made, which is about this issue with terminology. And we created that video when for Croaky, which is croaky.org. But they're around, you know, I'm Summer, and I'd be offended if someone started calling me by a different name. So, you know, we do need to be, you know, quite thoughtful around. We are actually referring most of it, like we're referring to Aboriginal and Torres Strait Islander people, particularly non-Aboriginal and Torres Strait Islander people. You are referring to a different groups of people, and it's not up to you to decide what we're called. Like it's not up to me to decide to call you by a different name. Yeah. Does anyone else have any questions or comments to make about this? Is there any other Aboriginal people or Torres Strait Islander people on the line that want to talk about anything in particular relating to terminology? You're a really quiet bunch.
Is there anything that we didn't cover that we've missed that you'd like us to comment on?
No?
I think there's a question.
Can I ask if so the question is, can I ask if the terminology used is the same in all states? There is variation across the states in terms of what people use. That's partly because, say, Western Australia, the traditional owners there are Aboriginal, not Torres Strait Islanders, so they predominantly use Aboriginal. But, you know, Aboriginal and Torres Strait Islander is respectful across all of the states, and so that is what we would encourage people to use. Indigenous is also something that is used, but it tends to be less accepted than Aboriginal and Torres Strait Islander. I should actually say that. Indigenous is often not a term that some Aboriginal people don't like, even when it's capitalised. But in terms of what to use in all the states, it really, Aboriginal and Torres Strait Islander applies to all equally.
And just to emphasise again, if you're unsure, especially if you're working with a specific group or talking about a specific group, ask them their preference as well.
Yeah, absolutely. I mean, you know, it's really important that, I mean, because to be honest with you, Aboriginal is a term that has been given to us. I mean, we as peoples, when we introduce ourselves, like I say I'm a Yorta Yorta woman, right? So I don't say I'm an Aboriginal woman. When I say I'm an Aboriginal woman, it's usually because I'm talking to someone who doesn't actually know what a Yorta Yorta woman is, and it's in a context, a mainstream context. So it's really important to actually recognise the traditional owners or the people that you're working with. Having said that, though, that can be challenging because you're always working on someone's country, but you may not be working with just the people from that country for a whole range of reasons. So you also need to be mindful of that as well. Is there any other questions?
Rosalie's just made the comment about local names being used incorrectly, such as Kuri or Murray. And again, that comes down to asking people what their preference is. If they're from New South Wales, they may choose to be identified as Kuri, or from Queensland, they may choose to be identified as Murray. But again, it comes down to asking people what their preference is, whether they like to be identified in that way or by their individual group or more.
Yeah, and the other point I'm going to make is also when we talk about individual groups, some people, because of the stolen generation, actually know that they're Aboriginal but don't know who their mob is. And for some people, that can be a lot of shame. So we need to be really mindful of that as well. I know people who know they're Aboriginal but don't know who their mob is, and it's no fault of their own. You know, their mother or grandmother may have been taken and tracing their history has been problematic. So being really mindful that when someone says they're Aboriginal, it might be just because we're making it easier because I don't have time to explain what a Yorta woman is, or it could be that they actually don't know who their mob is. And so communicating positively. Thank you for pointing that out. We actually used that as a base for this. I was aware that was available. There are some differences that we have with that, and I think that guide was written a little while ago, but the majority of it we still support. Now, we've got a few questions in. All right, you're getting chatty now. Communicating positively, we've just discussed. So we've just been asked at the beginning of a document, following Aboriginal and Torres Strait Islander here in Indigenous, what do we say to avoid offence? And I would actually suggest the wording that's been used there, like, we recognise Aboriginal and Torres Strait Islander peoples, and then herein we'll use Indigenous. I think that is probably the best way to go about it.
Yeah, I think that's the easiest way to go. Just remember to always capitalise Indigenous. Yeah,
otherwise you'll have me on DMing you on Twitter or emailing you about it.
Feel free to write letters to News Limited about their refusal to capitalise Indigenous.
Yes, or AAP for that matter. So I've just had a comment here about welcome to country, where I feel comfortable and safe delivering it to my local mob, but oftentimes don't acknowledge mob directly in other regions. If I speak as I worry about offending my elders, if I speak as I worry I will offend my elders if some recognise their country by certain names and mobs. Yeah, in this case, I acknowledge our people as Aboriginal and Torres Strait Islander. Is that okay outside of your country? And Troy, I'm assuming that's, my cousin Troy. To be honest with you, I do the same. If I know that if it's contested country and I am not wanting to offend any particular people, I am not from a country, it's really important. I actually often just acknowledge the traditional owners of this country and leave it at that. Where you can actually acknowledge the traditional owners by who they are is really important, but where it is contested country, it is important not to enter into that debate intentionally or unintentionally. But thanks for bringing that up, Troy. That is something that I think comes up for a lot of people. And sometimes you actually aren't even aware at times that it's contested country. So you can unintentionally do that. And I mean, Brisbane is contested country for part of it. And I wasn't at Canberra. I wasn't aware of that for quite some time. So, and again, when you're actually doing it, sometimes say government websites might actually say the traditional owners are blah, and they're not acknowledging that it's contested. So sometimes it is actually better, I would suggest, to talk to the Aboriginal communities rather than, look on the web at times alone and take that as given. I appreciate that it's not always easy to talk to local Aboriginal communities or land councils, and you will do your best to do that. But if you have the time and the capacity, and also you know where to go, always actually have the chat to the local people, particularly if you're running large events.
Yeah, absolutely.
Yes, okay. So we've just been asked about different spelling of different people. This is a bit of a tricky one. I mean, so for those of you that don't know, my undergrad major was linguistic, and when we're talking about p and b, p and b are actually, the only difference is voiced and voiceless. So it's just that whether or not your vocal cords are actually vibrating or not. And so we were with oral traditions, we didn't have writing, and this different spelling comes from the different linguists which worked with different parts of the community to codify the language, so basically write down the language. And so the differences have really come from the different linguistic backgrounds of the people that are working with that local mob. So it can actually be really challenging you can actually enter a minefield when you do the spelling differently. And to be honest with you, I've got no solution to that, but I would suggest that you talk to the local community about what is generally accepted. And again, there is contested space here. You're not going to please everybody, and that doesn't mean that you can avoid trying to do anything at all, but what it means is you do your best to be as consultative as possible and to be the least offensive as possible. But you will find that at times there is going to be difference of opinion.
And I'd also suggest if you're unable to speak to the local community for some reason, that IATS is also a good source to resolve that.
So someone's just raised here, welcome to country. So there is preference, there's custodian and ownership. So welcome to traditional owners, traditional custodians. To be honest with you, I don't have an answer for that. I know that there are different opinions on this. And I have an opinion on this, but it is actually quite contested. So I think that's something we probably haven't entered into at this point. And again, I would go back to, if you are running an event or if you work on a country in particular, talk to the local mob there, and they will tell you what is their preferred term.
And if you are running an event, obviously ask a local elder to actually do a welcome to country would be the preference, rather than somebody else doing an acknowledgement.
Yeah. And so as the Public Health Association, we actually do encourage acknowledgements for meetings for our events, and do get in people to do welcome to country. And that's really important for us because, I mean, as my mum says, a welcome to country is about, you don't just walk into someone's house, right? So you knock on the door and you ask to be invited in, and essentially a welcome is someone inviting you and welcoming you to that country. An acknowledgement is actually, acknowledging that this is and always will be Aboriginal land, and that we all coexist here, and that we have an important role to play in this space. I'm just going to see if we've missed any questions. The spelling. If I've missed your question, would you mind just rewriting it? Apologies, but we just do have a large number. So can we just actually be clear the difference between a welcome and an acknowledgement? So a welcome to country is done by the traditional owners of the land that the meeting's being held on. So every speaker doesn't need a welcome to country. That would actually be quite time consuming. And once you've been welcomed, it's a welcome for the whole event. Where an acknowledgement is actually an individual saying, I acknowledge that I'm standing on someone's country, and it's respectful. It's like saying please or thank you. It's about manners. And so it takes very little time, and I would encourage everybody to do an acknowledgement at the beginning of their speech, or presentation, or whatever it is that you're doing or meeting. And some people feel that it's tokenistic and that using the specific language is tokenistic. I think the specific language is there as the minimum bar, and that this is what we actually encourage people to use that may not feel comfortable with it or maybe new to it. But I also have seen people where, and I often do it, I use the language, and then I'll actually kind of, throw in a little bit of my own spin, and it usually is when I know the country quite well, and I want to acknowledge how beautiful this country is, and that I'm actually standing on country that I live on and work on, and that kind of thing. So, but no, you don't need to do a whole welcome at every speech, but I would encourage you to do an acknowledgement at every speech, particularly, i.e., if you are at an Aboriginal event, it's probably going to be frowned on if you're not in particular. But it's actually really important to do it at non-Aboriginal events as well, because, again, it's actually showing that you recognise you are actually on Aboriginal land.
And I think when you do that acknowledgement of country, even if you, as the questioner said, if you've only got 10 minutes speech, it helps you remember where you are. And I think that's really important too. It grounds you and reminds you of the traditional custodian.
Yeah, it is. And for a long time, we've been whited out of this history of Australia. And, an acknowledgement is part of recognising that we are here and we always have been here. And it is kind of addressing some of that historical imbalance as well. And thanks, Troy, for joining us. I just noticed that Troy has had to leave. And if anyone else has to leave, thank you for joining us as well. We do have another 10 minutes if anyone has any additional questions or comments they want to make. But one of the things I do want to say while we're waiting for questions is that we appreciate that this is not straightforward, that sometimes it's not obvious, which is why we also created the guide, was to assist people to navigate some of these minefields. Oh, I can hear myself. Can someone just mute it? Hearing my own voice is quite... Yeah, if you could just mute your microphones, that's awesome.
Somebody, Helen Kelso just raised her hand.
Oh, we've had our first hand raised. Thank you, Helen. Did you want to ask a question?
So, Helen, we think you just used the hand raise feature. So did you want to unmute and actually ask your question?
Thanks. Can you hear me now?
Yes, we can.
Look, thanks very much. And I would have done it anonymously through the chat, but I couldn't. So I'm here in profile. But look, could you just enlarge on the strengths-based approach to presenting findings from research or results? Because, sometimes, and I'm thinking of a particular study we've done where, the findings are pretty negative, and, the health outcomes that we found in Aboriginal Torres Strait Islander populations compared with the other working population were pretty negative. So I'm wondering how we could present this, I can see how we might present it in a positive way, but I'm wondering if you could enlarge on approaches taken.
Certainly. Well, some of the approaches taken that I'm aware of have included looking at, so that this is getting a bit beyond just terminology, but looking more at how you might present results. But looking at, when speaking with community, look at what they see as the local strengths and solutions are. When discussing the problems, with assuming that you would have consulted with community process, working with them to see what is possible within their community. I mean, I'm not sure what field it was in, but as an example, looking at I'm thinking of just some work I was recently doing in suicide, and some of the real positives within the community were the cultural strengths within the community, so that cultural basis and how it brought people together, that network within community, and the level of the level to which people could rely on one another was really important. Looking at the resourcefulness, despite potentially, there may be poverty, that just may simply be a fact, but there's great resourcefulness to manage that poverty and to manage a really positive as possible lifestyle. So there's, and relationship connections are really, really important. There's a number of things that sometimes we don't look at coming through a kind of non-Indigenous researcher lens as well, and I myself am conscious of that as well. But certainly asking what the local solutions, what you see as are needed in local solutions, and what can be built upon around what they're already doing.
And one of the,
that's good. Thanks.
If I can add to that, one of the things that I also think about is the context as well. So there are some negative stuff, obviously. I mean, we'd all be out of a job if there wasn't. But it's also about the context around why things are the way they are, and being careful. I'm not saying you do this, but I'll give an example of something that somebody has done which has drawn really inappropriate conclusions based on their findings. And it's because of the deficit, dialogue, where they did a comparison. So this was, I'm going to name and shame because it's a public article. It was Sydney University School of Economics did a comparison study looking at investment in prevention and investment in hospitals to see which actually had a greater impact on Aboriginal and Torres Strait Islander health. And of course, they realised that their findings came up with that it was preventative health investment that actually had better health outcomes. But in the discussion, what they actually said was that it was a defining characteristic of Aboriginal and Torres Strait Islander people to have poor lifestyle choices. So, I mean, the deficit mentality is what would have driven that response, where they're now labelled all of us as having poor lifestyle choices, but they've also used the word choices, which actually ignores some of the contextual information. So food security, for example, in a remote community in the wet season is challenging. And is that the individual people's fault then, or is that, a broader issue that needs to be addressed? So I think that it can be quite challenging. You are right, particularly when it is negative, but you're also being mindful of the context. So we've also seen the conversation around STIs, right? And so often it gets conflated, and being really careful and really considered in the language that you choose, that it's really specific to a local area where this data is from. And contextualising that data, I think, is one way of actually, in terms of, we're talking about Tennant Creek, and the reason why this is happening might be that. Yeah.
Agreed.
Thank you.
Yeah.
It's very helpful.
Yeah, no problem. Does anyone else have any other questions? We've got, 3 minutes. No. So for those that, oh, sorry, I didn't mean to ignore your question. I forgot. But I am going to ignore your question respectfully. I have a very personal opinion on the custodian versus owner, but this is a very personal opinion. And given that we're here representing the PHAA, I don't feel comfortable sharing such a personal opinion when it's such a contested space. So I can appreciate why you would like an answer to that question, but I'm not sure this is. I'm happy to have a conversation with you offline if that would be more appropriate. So sorry for ignoring your question, but I'm going to respectfully ignore it.
I use both personally, I'll say.
Yeah.
So.
But there are really difference of opinions around that. I mean, I'll give it, I can do a, basic one, I guess. So custodianship is on one level, as it sounds, caring for custodian, but no ownership. So it's that, and then owner is about, that model and the Western interpretation of ownership of, and there are pros and cons for using both. Custodian doesn't really demonstrate much sense of ownership, right? So it's a bit softer, where ownership is a stronger term. So it does depend on how you feel about those terms in particular, and the context you're using it in as well.
I think also if you're acknowledging country and you're not doing it by rote, you're actually, as Summer was saying, you're speaking about the country you're on and relating to it in some way. I think you do just tend to, one word or the other comes out. It's not that you've specifically planned by it. Although I appreciate Summer has a certain way.
Yeah, and look, I to be honest with you, tossed at different times because obviously there are different connotations, and there are pros and cons, in my opinion, to both. So, and I think, again, it does depend on the person. One is what I would consider to be softer, custodian, whereas ownership is a much stronger term. While ownership is something that is a Western term, it is something that is, I think, better understood by predominant, like the mainstream audience. So, you know, some people may choose to use it for that particular reason. Yeah. So again, I think that this one is something you need to consider from a personal perspective, but also from the people that you're engaging with. So I think that's it, unless there's any last minute burning questions. We might wrap up. So you may have noticed in the email that was sent out that we are recording this. So this will be made available to members in our member portal. We haven't done that before. We'll figure that out. We will actually send you a link to that. And finishing on time, yes. Anyone who knows me quite well knows me that I'm actually very punctual. So I'm always a finishing on time person.
Can I just say something?
Of course, David Temple, our president's here. So it'd be great just to have him wrap up for us.
We're on mute, Reg. Yeah, definitely. Did they ring me just?
You want my chair, David?
Is that right?
Yeah, of course.
Is there a document? There is a document.
No, they were talking about all sorts of stuff just now. I'm pretty sure I know.
Hi, it's David Temple speaking. I just wanted to say a few words on behalf of the Public Health Association Board. Firstly, I want to thank you for your participation in this important webinar today, and the board would give its commitment if there are people who missed out today. We'd certainly happily to run more of these webinars to make sure that it's such an important issue that we don't sort of let it sort of slip by, where people who missed out today can pick it up at some other stage. The board, as far as I'm concerned, treats this matter as a very, very serious issue, and it's really critically important as far as the PHAA is concerned. And we are fortunate on the board to have Carmen Parter, who's the Aboriginal and Torres Strait Islander representative on the board, ably backed up and represented in her absence recently by Summer, who's here today. So we're very, very seriously grateful for their support that they give to the PHAA board. And so we do take it very seriously, and it is a very significant leadership issue that was mentioned in the conversation here today. It's important that PHAA gets this right. In other words, we just can't afford to be, half-baked in tackling this. We've got to be consistent, as Summer said in her opening remarks. It's really about upskilling our membership and what's appropriate. We don't want to sort of think in half-baked sort of terms. It's got to be appropriate, and if we can't work it out, we'll work it out, and we'll work it out with Aboriginal and Torres Strait Islander people. It's about how we be least offensive as possible. That's another critical issue, the message that Summer made. So again, I just want to say thanks very much for all your participation. Jeannie, I'm delighted to see you on face-to-face, that you got the technology right. So well done, it's great to see you. And thank you very much for your contribution and everyone's contribution today. So as I said before, the numbers here today, we're expecting 100. I think we ended up with just under about 50 people. And so there's obviously 50 people who obviously missed out, but we're more than happy to catch them up. But again, thanks very much for attending this important webinar, and we look forward to being involved in others, and there will certainly be other board people involved in those as well. So thanks again to Summer and also to Yvonne, and I also thank you for your participation.
And I guess from our point of view, we also are very grateful for the Public Health Association for taking a leadership, for being leaders in this space. So it's great. It's a great organisation to be engaged with, actually. Thank you. So we're going to wrap up there. Thank you for joining us. As I said, this has been recorded and we will share it. It's a lot of information, so we appreciate that you may want to review it. And we know that you've been very busy and may have had to join us late. So if you missed it, you can.
Thanks again for joining.
Thank you.